Anyway, thank you all for joining today. Looks like we have almost 200 people, and we're glad to have you. My name's Tom Danowski. If we haven't met, we're glad to have you. You're joining the sort of the latest in our regular series of Team Tuesday meetings that the Wine Board has been having in conjunction with the Willamette Valley Winery Association over the last several months. We've been meeting regularly and talking about issues that are of interest to the industry. And this is a sort of a special edition of that series, which will continue next week, sort of back as we've been doing all of our other meetings, talking about a grab bag of issues next week. This session today is a special edition, specifically focused and embracing a larger audience of partners and a larger audience of industry members to talk specifically about safety protocols and requirements and recommendations that are being made to vineyard owners and wine business owners to ensure a safe and outbreak-free harvest and crush period. We're going to be sharing the information that'll be reviewed today. It's kind of broken up into 3 sections. We'll share it. We are going to be open to fine-tuning some of the material as needed after today, and so we're not going to share it as soon as this call is done. We're going to amend it as it's required. In fact, there's a lot of late-breaking information. One really important piece just was published yesterday at 4 o'clock by Administrator Wood at OSHA with a draft of a new temporary standard related to infectious disease. And we'll be touching on that today, but there might be some questions that will come in the next couple of days on that and some other materials. So we'll share the presentations just as soon as we can. This meeting, like all of our Tuesday meetings, are recorded. So if you have somebody who can't be here and wants to participate, or if you have to punch out early, it'll be recorded. That will be sent out by the Wine Board. And I would also say that some of this material might be review for those who are attending, and anyone's invited to attend the Willamette Valley Winery Association's Thursday morning calls. Prepping for harvest issues are addressed in those forums, and those will continue. So there's no shortage of opportunities, hopefully, to get the information. I will say before I turn it over to our first speaker that, this has just been the outgrowth of just an extraordinary collaboration, both, intra-industry and embracing growers and winemakers all over the state. And it's included walkthroughs at a winery and walkthroughs in at least one vineyard to identify areas where special care needs to be taken with our workforce. Beyond the intra-industry collaboration, we're really glad and very grateful to people from the Department of Ag, Oregon OSHA, the state's health authority, Oregon State University, both faculty and extension specialists. Oregon Liquor Control Commission is here with us today, our government affairs specialists, Dan and Evan, attorneys from Davis Wright Tremaine, county health professionals. This is really a crowdsourced gathering and a crowdsourced collection of materials, not specific to any one agency or industry or industry group. So thank you for all that. I will say that you probably will have questions. Q&A time has been built into each of the 3 sections of the presentation, and we'll have some time at the end for anything that didn't get addressed. And if something comes to you later, send it in, and we'll try to get it addressed by the correct person. As we go through this presentation, you'll hear us occasionally slipping into some jargon, words like guidelines and toolkits and standards. And also intra-agency playbook has been developed for some of our state agencies, but guidelines and toolkits and standards will be talked about today. We'll try to make sure we define those and ask our speakers to help us just keep those terminology points clear, because there are some really important distinctions. I think I'll stop there and get ready to turn it over to our first speaker. Our agenda today is to go through in 3 sections the information that's been prepared, and a lot of folks have done a lot of work getting ready for today. We'll start with vineyard guidelines and safety protocols. From there, we'll go into winery standards and protocols. We'll also be including in those sections chances for our colleagues from ODA and Oregon OSHA and the Health Authority to comment on their playbook, and also to introduce some of their colleagues. I know there's at least one epidemiologist on the line and some other specialists from other agencies that will have answers to questions, but also some comments to make before the Q&A. I'll stop there and see if Morgan or Mike, there's anything else we should talk about before we get into agenda item number 1?
No, Tom, I'd move forward.
Okay, that's great. I want to make sure to acknowledge Lee Bartholomew and Mike McNally and Anthony King, who along with Morgan will kind of be our co-hosts and co-moderators here on this call. They've all just taken extraordinary initiative here to gather a bunch of their industry colleagues and a really strong collection of outside expertise for this call. We'll start, as I said, with the vineyard guidelines and protocols related to vineyards. There will be some comments here from Lee Bartholomew first, then Jennifer Ekdahl from OSHA. And Lee, if I can turn it over to you to take us through the PowerPoint slides that are relevant to vineyards, that would be great.
You bet. Thank you everybody for being here again. I appreciate it. We've got a lot to talk about today, and like Tom said, we're starting out with the vineyard guidance, and we will have several speakers starting with Jennifer Ekdahl, and Jennifer is the Senior Occupational Health Consultant from OSHA. And so she's going to walk us through the toolkit that's been put together by OSHA and remind us of some important safety precautions for always during agricultural work, and then specifically right now during these times of COVID. So I will let Jennifer take it from here, and then we'll move into some industry specific guidelines as well. So Jennifer, the floor is yours.
Thank you. First of all, thank you very much for having me today. Can everybody hear me okay?
Great.
So my first question is a technology issue. Is someone going to be flipping my slides for me?
Yes, Stacy is working on that in the background. So if she's going too slow or too fast, you can give her some guidance, but she'll be moving forward.
Okay, thank you. So basically, if we could get to the slide with right after that one. So as I was already introduced, I'm a health consultant with Oregon OSHA, and I'm actually out of the Salem field office. We do have offices all over Oregon. So there are consultants in all of the offices if you do have questions or want consultations. What I was asked to do today or this morning is talk about the new, well, it's not new anymore. It's a temporary administrative rule for agricultural employers as well as labor housing. And then I'm going to talk about heat illness prevention, just to give you some reminders about that. So let's start with the temporary agriculture rule. Basically, this became effective May 11th of 2020, and it is supposed to stay in effect until October 24th. It's basically 180 days. And I did have the opportunity to talk to Matt Kaiser, who was the draft person of the new COVID-19 temporary rule. And he did assure me that this ag rule is going to stay in effect because there's certain specifics just for ag. So for those vineyards, we're going to be applying this rule. And I'm just going to go over some of the highlights. I do encourage everybody to read the whole rule. The first one is about appointing physical distancing officers. It's also called social distancing officers. Oregon OSHA isn't telling you how many officers you need. We just need to make sure they're effective. And basically their responsibilities are going to make sure people are practicing the social distancing of 6 feet apart, as well as wearing face coverings if those are required, and sanitation requirements. In addition to having social distancing officers, we do expect employers to try to implement physical distancing with work practices or even changes in your patterns or flows that you're doing into your procedures. So an example I'd like to use with one of the wineries I was recently at is they're making spots on the floor in front of the time clock so that they don't have everybody bunching up at the time clock. So everybody's going to stand 6 feet waiting their turn for the time clock. So in addition to doing 6-foot separations during work activities, we also want to make sure you can include the breaks and meal periods. As you know, people are taking off their masks and they're eating and drinking and probably socializing. So you really want to make sure that they're keeping their 6-foot social distancing even during their breaks and meal periods. In the rule, it also notes that if you as an employer are notified of a COVID-19 positive case, we do want you to follow Oregon Health Authority's rules in immediately reporting that to them. So my recommendation would be to get a hold of your local health authority for your county and find out what procedures they have in place, like what phone number do you dial or who are you supposed to contact. Just do that ahead of time, and that way you're ready for that. And then finally, there are provisions in this rule regarding if you have a confirmed or suspected COVID-19 case, you will need to isolate them, and it's specific towards labor housing. So what that means is we want you to isolate those those people that are sick from others that are not, and you are allowed to have one person, hopefully someone like a relative, that can take care of the sick person. And then as an employer, you do need to make sure that they are getting food and water. Next slide, please. So this rule has been divided into 3 sections: field sanitation, labor housing, and transportation. So now I'm going to break it into those 3 items, starting with the field sanitation. One of the big things that are affecting you as far as vineyard owners or people that are working the vineyards is that we have increased the toilet and hand washing facilities to 1 per 10 workers. It used to be 1 per 20 workers. So now we are requiring 1 per 10 workers. They also need to be placed in the fields either at the entrance or the exit of the field and within a 1/4 mile of the workers. And that basically alludes to about a 5-minute walk. There is a little bit in that rule that says you can also place them in harvested parts of the field. However, I don't know if that really works with vineyards compared to like corn. So just keep in mind, you need to have them at the entrance or exit of the field. Sanitization is very important, as we all know. So we're requiring that you do 3 times a day, you sanitize the toilets and hand washing facilities. And this probably what you'll want to do is designate someone that has that responsibility so that you make sure it is getting done 3 times per day. And then Oregon OSHA also revised our field sanitation notice. So it's going to include some information on prevention of COVID-19 and some training information. And you can find that on our webpage. If you haven't been to our webpage, it's at osha.oregon.gov. And if you look on our, under agriculture, there we have a index A to Z. If you look under A for agriculture, bring that up. You're going to find this rule. You're going to find those updated field sanitation notices. And you just need to post them like you used to, you know, at your porta potties or the central locations. Next slide. So labor housing, basically we have provided additional guidance on registering your temporary housing. This is mainly because we're requiring some social distancing, so you may need more temporary housing. Also, if you have positive cases where you need to, you know, put them in a separate facility. So this temporary guidance is basically talking about how to get quick registration or using hotels and motels. So make sure you look into that and read the full rule on that. And then again, in the labor housing, we do need you to have a physical distancing officer or officers, and they need to ensure that people that are unrelated need to stay 6 feet distancing. Again, we are requiring more toilets, 1 per 10 workers instead of 1 per 15. And we are also prohibiting the use of bunk beds for unrelated individuals. So if they're related, you can use bunk beds, but unrelated, we're not allowing bunk beds. The beds also need to be separated by 6 feet. If that's not possible, and it's 6 feet all the way around the bed, if it's not possible, we allow you to create an impermeable barrier. And this can be, you know, the plexiglass, the thick plastic, it could be plywood, and it goes from the floor to almost the ceiling and the length of the bed. And the other thing to keep in mind is we need you to keep an aisle to the bed, so that's 28 inches. So keep those impermeable barriers at least 28 inches from the bed. The common use toilets and hand washing facilities need to be sanitized twice daily. And then finally, employers need to provide cleaning materials so that the occupants can keep their homes clean and sanitary as they want. So next slide, please. So transportation. So if you are taking employees in employer provided vehicles, we do allow that, but they need to be able to be physically distanced by 3 feet. In addition to that, they also need to wear face coverings. That's the passengers as well as the drivers. And all the high contact areas, so you think of the door handles or the steering wheel, window controls, they all need to be sanitized before each trip. If the vehicle is being used continuously throughout the day, it needs to be sanitized at least twice daily. And then finally, we're hoping employees will take these lessons and use them in their own personal vehicles. So we do require you to train your employees and encourage them to practice that 3-foot social distancing as well as wearing their masks and cleaning the high contact areas twice a day, or at least before each trip. So we're hoping that you teach your employees these and also that they'll use them in their personal vehicles. So that's pretty much the entire rule in a real nutshell, but I do encourage everybody to take a look at the whole rule and read that. I'm gonna jump now into heat illness prevention. Most of you know this already, I'm sure, but we have an emphasis program, and it is in effect from June 15th through October 1st every single year. Unfortunately, we do have fatalities almost every year of heat illness, so we do want you to train your employees on the hazards of heat, the symptoms of what they may have if they do have heat illness, so that they can recognize those symptoms, or even in their coworkers, how to prevent the heat illness, and also make sure they know how to respond if someone is becoming ill. Make sure you're providing adequate amounts of cool potable water and breaks so that we can try to prevent heat illness. And then it also says provide shade for breaks. And there was a good question out on the vineyard when we were touring that. And basically, obviously with vineyards, you don't have a lot of shade unless it's probably on the outskirts of your vineyard. So this is a recommendation. It is not a requirement. But if you can possibly give them shade on those hot days, that would be awesome. Another important feature is to train your employees on how to acclimate themselves for the heat. Drink lots of water, fluids 3 days before you work in the hot. Don't drink a lot of alcohol, get lots of sleep, eat right. Those kinds of things are important. And then finally, emergency procedures. It's so important to have these emergency procedures in place before you have an emergency, so that you know what to do and your coworkers and workers all know what to do in an emergency. And then finally, I wanted to share with you, there is a mobile app for iPhones, and I have one on my phone, and it's called the OSHA Niosh Heat Safety Tool, and it's free. It's an excellent tool. You can bring it outside, and it'll tell you what the risk is for heat illness. It also includes first aid measures and symptoms. So I highly recommend downloading that app and putting it on your phone, even your workers on their phones. And then I just want to summarize here to encourage everybody to go to our webpage if you haven't been. It's osha.oregon.gov. Thank you.
Super. Thank you very much, Jennifer. I appreciate that. I think what we're going to do is get through a little bit more my talk, and then Isaac from the ODA, and then we're going to open it up to questions at the end. But folks, please feel free in the chat at the bottom to add any questions. We'll do questions that way. You can add them now, and then I'll be moderating those a little bit later in the talk. Thank you. Okay, so I'm going to do a little bit of going over what Jennifer talked about, as well as adding just some specifics that are very vineyard focused. And as Jennifer alluded earlier this year, a couple of weeks ago, not very long ago, several of us who work in vineyards, plus Jennifer from OSHA, Rusty from the ODA, and Gary from Yamhill County Health Authority got together in the vineyard and just had a dry run, a practice run of here's some bins on a trailer and buckets, and we were in the vineyard, and we just wanted to make sure that what we were planning on was what the OSHA and ODA and health authority experts agreed was the right way to be thinking about some of what we're doing and to showcase some of the challenges that we have. So all of these things that I'm talking about, I feel like we need to think about through the lens of different people. One being the pickers, the people who are pulling leaves. This is, you know, of course, specific to harvest, pulling leaves, our tractor operators, and our truck drivers. So we have all these different categories of people, and we need to be thinking about them each as we go through some of these guidelines. So when we're talking about having physical distancing officers or social distancing officers, I think the hardest part that we need to think about is how the leaf pullers interact with the rest of the world, because they're the people who are sort of on the front lines of what's happening during harvest. They're seeing more people than any of these other groups of harvest workers. So really thinking about each person's role and how we might be able to physically distance. And I'll go through some specifics a little bit later. Because this physical distancing, it's required everywhere in the field when we're working, even when we're wearing masks, because the way I understand it, if we do have a person who becomes positive with COVID, we need to look at everybody who's been within a 6-foot distance of that person for more than 15 minutes cumulative in a day. And so the more opportunity we have to keep folks separated by at least 6 feet, the better chance that we will have of not, even when they're wearing face masks and shields, the better chance we will have of not having an outbreak spread beyond that person. Let's see, we did talk, so these ideas of face masks and physical distancing kind of go into all sorts of PPE, and we talked to Jennifer about wearing gloves and whether gloves would be a good idea out in the field, and I think the consensus was that gloves, while they're nice, might be one of those things that give you a bit of a false sense of security. They might protect your hands, but if you're still touching your face and if you're not washing your hands and you're not using sanitizer, it might not be the thing that's the end-all be-all of sanitization. So be thinking about that if you're requiring people to wear gloves, that they still, you still need to be using sanitizer, you still need to be washing your hands, you still need to not be touching your face. Okay, so the next slide, please, Sally, or sorry, Stacy. More general guidelines. So a workplace coordinator, if somebody does test positive, we need to have one person within our businesses who is typically the HR manager, who's staying up to date with all of these changes. As Tom said, you know, we had new regulations just yesterday as of 4 p.m. that we'll hear about in a little bit, that things change, and I suspect that they will continue to change as we learn more and as the world continues to learn more about how to deal with some of these issues that are coming up. So somebody needs to stay up to date and have a connection with the public health authority. And a little bit later in the presentation, there's a list of all the public health authority representatives and their phone numbers and contact information. Having a written emergency response plan, and again, we'll talk about that a little bit later. Mike's going to talk about that toward the end of the session, is very important. And establishing a confidential process so that people can let you know when they're sick. Some people might be afraid, you know, for their job, or afraid that they won't have a paycheck and they don't want to tell us if they are sick, but being able to have a confidential process so employees both know that they're being supported and that there is COVID pay, and understanding what your business's responsibilities are and resources are for COVID pay should somebody come down with an illness is very important, because that way we can support people and they won't be as afraid to let us know what's going on. Continuing business with a reduced workforce. I think for us in the vineyard, this is slightly terrifying, as it is in the winery and everywhere in all of our businesses. But when we know that there's such a limited time for harvest, functioning with a reduced workforce, whether that means, do you have a crew of people who's working today who the 2 leaf pullers don't show up, probably because, let's just assume because they're sick. What do we do there? We can't bring 2 people from another crew over because we want to keep our worlds as small as possible. So just trying to understand how, if you have a reduced workforce, you're going to manage your pickers, your leaf pullers, your tractor operators, your truck drivers. So conducting weekly training or even daily training on workplace safety and sanitary operations, you know, whether you do calisthenics in the morning, everybody in one place, where you're able to do training and talk to people about how to maintain safety both in the workplace and then at home, you know, talking to people about how they're feeling that day, if they're having any symptoms, if you need to be, you know, sending somebody home because they're sick and they just hadn't mentioned it before. So having a time during the day when you can talk to people, and then training as new information comes up, or just as a reinforcement of current information that we already have, it's critical to just be talking about it as often as possible. Next slide, Stacy. So that goes into screening and monitoring people. How do you talk to all of your employees, especially folks in the field and on the crew, about how well they're feeling, if they're sick, to stay home, how to send people home once they've arrived at a pick during the day and you find somebody who's not feeling well? What's the process? And you know, we found it's a harder thing to think about. What is the process? How do you actually get somebody home when they arrive in a car with other people? Do all of those people go home? Does one person take them? Are you going to pay that one person who takes them home? Just thinking through the whole process, and everybody's idea is going to be slightly different, but if you know that ahead of time, then the day that it happens, because I think, as Rusty will tell us later, it's not if we have somebody who's positive for COVID, it's when we find out, because there's definitely somebody out there right now who is positive for COVID, and we just need to be thinking about that in that way all the time. So talk to folks at the beginning of the day about how they're feeling. Consider using temperature checks. I think everybody's got a different opinion on whether it's the right thing to do at your workplace, whether you have, an example was a van full of people who might be coming. Maybe the van driver has a thermometer at the beginning of the day, and before anybody even gets in the car, temperatures get checked. That would have to be something that was happening on a daily basis. And then a reminder that this is private medical information, even having your temperature. So it's not something that can be written down in a place where everybody can see what your temperature was on any given day. So if you're below 100, I think the reasoning, the idea is that if you're below 100, you are considered healthy. And so maybe there's a little list with your name and you just put a check mark next to it that says that you had a temperature below 100. And if it's above 100, that's when the suggestion is that a person should not be working, should be going home. And just a reminder to talk to people when we're screening them and monitoring them about how they do get to work, who they're with, that they should be wearing masks, rolling down the windows, keeping lots of airflow in their vehicles, and thinking about where they are when they're at home, and who, like for me, I assume my kids are my biggest vectors. So who are my kids spending time with, and how do I minimize that, that risk? Okay, the next slide, please. So just reinforcing hand washing, not touching our eyes and our faces, sanitizing, and the EPA has a really good list of a lot of sanitizers that we can use, hand washing stations. And when we talk about having sanitizing agents especially on our porta potties 3 times a day, we're taking to just having 1 bottle of spray hanging on a rope from every porta potty. That way it's very easy. When it's time to go sanitize that, it's right there. If somebody wants to use it and feel like they would like to sanitize the toilet an extra time, the sanitizer is right there. I think that it's not the time to skimp on sanitizers, but do buy stuff now. I know even finding those little spray bottles is really hard. We can't find enough for what we need. So every time I go into a store, as silly as it sounds, I'm looking for spray bottles. We're trying to restrict the use of anything like this by multiple people. So even those sanitizers, while we have one hanging on every porta potty, we also are giving a hand sanitizer spray bottle to every one of our crew supervisors, every one of the tractor operators, every one of the truck drivers. That way everybody's in charge of having their own sanitizer. They're gonna have their own Sharpies, they're gonna have their own rolls of duct tape, they're gonna have their own little first aid kits. So where we used to have things that were shared by crews, we're having things that are specific to certain people now, and things are not being shared from one person to the next. To the next slide, please. This is easy for us, I think. The idea of increasing outside air supply, certainly in the vineyard. We don't even need to think about that. The air supply is always fresh. But when you have tractor or truck drivers in their trucks, a reminder to keep windows down in our places where we have our admin teams working and we have people doing payroll and things like that, making sure that we're thinking about opening windows, having air supply increase for the HVAC, having more air, outside air coming in, and thinking about really protecting our admin team as well, because we think a lot about what's going to happen with the pickers and the leaf pullers, but what a critical role the admin team have, especially, especially now during harvest, but all season long. Okay, next, please. Farm labor contractors. A lot of us work with farm labor contractors. I know that there's some on the line today. Thank you for being here. But please make sure that while we're taking care of our own teams, we're also taking care of the farm labor contractor teams, talking to your contact with them about what all of these regulations are, social distancing, masks, all of that, because it's one step removed, but just so important to make sure that we're all on the same page, because there is a lot of closeness at harvest. And again, back to the admin team, just reduce the amount of paperwork that's being passed back and forth, new hires at the beginning of the day. As much as that can be done out in the field rather than coming to the office, so that there are fewer people inside the office, and then just get it done once and hopefully keep your team in place during the season so we don't have to rotate a lot of people through. And in the office, paychecks probably go out to the field. You don't have a line of people coming to the office to come pick up a paycheck during this time, which normally would happen, but trying to keep smaller groups of people in more places rather than large groups of people in one place. Some specific things that came out of the vineyard walkthrough, have these team groups, these cohorts of people that are not intermingling. The next slide, Stacy, please. That are not intermingling. So if we have a group of people who are picking, and let's say it's a group of 15 people, 12 of them are pickers, 2 of them are leaf pullers, and 1 is a tractor operator, and they stay together always. And if the 2 leaf pullers don't show up, then it might be that two pickers need to become leaf pullers for the day. And I think this is a big part of the conversation, is having a good communication plan between the vineyard and the winery, so that before the first day of harvest, you've decided if there's a cap on how many tons can be picked in a day. We're gonna have these smaller groups of people. We can't have a 40-person team of pickers all in one place trying to pick a huge amount of fruit in a day. What the hope is that we can have these smaller groups that always stay together. But what that means is probably fewer tons picked in one location at a time. So if you have a vineyard and a winery where maybe you would want to pick 60 tons in a day and then the next day 10 tons, it might be a good time to have a conversation with the winemaker about, can we spread those 60-ton days out so that our days are a little bit more predictable and more even for these vineyard crews to pick. So having this conversation about that, about what the leaf, when most leaves are going to get pulled out, is that going to be a thing that you're trying to minimize the amount of time on a sorting line, and so it needs to happen in the vineyard? And then what does that look like in the vineyard? Because having 3 people clustered around a bin trying to pull out leaves might not be potential in this year. Do you have more bins that are getting filled at a time and they're not all full? Are you going to be okay with that when some of them arrive to the winery and they're not all full because you spread so many of them out in the vineyard trying to separate people? And that might be just fine. Are you going to go through the day before harvest and pull 100% of the leaves on one side so that you can pick and not have as many leaves actually getting into the buckets? That might be an idea too. So there are several ideas there, but think about, what would work best in your situation and talk about it now with folks. The one other thing we've talked about, or 2 other things, we've usually used a punch card system for harvest for tallying buckets. That is not very socially distant. So for ourselves, I know we're going to a call out system where every picker will have a number. And let's say you're picker number 1. When you get to the end of the row, you just say, I'm picker number 1 and I had 2 buckets. And somebody writes that down on a piece of paper. There is a lot of trust involved there. It's worked in the past. I'm sure it can work again. And that just reinforces the idea of a picker having their number, and maybe you have buckets that are allocated to that specific picker as well. So you have picker number 1 yelling out their bucket, how many buckets they have. They're dumping their own bucket instead of somebody helping them this year. Another reason why it might be a little bit slower. And their buckets have their number or their name written on them or whatever it might be, some way to indicate that these buckets go with this person and we're not swapping buckets around with everybody. So lots of small ideas here, but hopefully they're helpful when you think about what harvest is going to look like in your field. And with that, I have talked too much and I am going to quickly turn it over to Isaac Stapleton, actually, from ODA. And Isaac's going to talk to us about the Agricultural and Farm Toolkit. A lot of this is similar to what Jennifer talked about, but very specific to the toolkit that hopefully you've all seen. And I'm sure Isaac can direct you toward right now. So Isaac, are you on the line?
Yeah, I'm here. Can you guys hear me?
We got you.
Excellent. Okay. Yeah, thanks, Lee. Like Lee said, I'm Isaac Stapleton. I'm the program director for the food safety and animal health programs at the Department of Ag. And a lot of what Lee just covered in her information is very similar to the toolkit that the department put together for ag and farm operations. So if you haven't seen that, it is available on our website under our COVID specific page. And I can post a link in the chat if that helps after I'm done talking here. I wanted to back up just really quick on why we even developed the toolkit, and that leads to the playbook process, which I think we've got some folks on the line from OHA who will talk a little bit more about the playbooks, which are an agency to agency document. But a lot of that came out of the need for consistency and coordination between the various agencies for when we respond to positive COVID cases in any type of ag-related operation. And so what we developed was that playbook process, which triggers us to kind of implement our toolkit and do a toolkit consultation. And it's triggered on one positive associated with a facility, but it doesn't necessarily have to be. It can be proactively scheduled. So if there are any operations out there, winery or vineyard operations that want to contact the department and have us come out and basically walk through our toolkit and cover a lot of the stuff that Lee just covered in the winery or vineyard toolkit that she just talked about. We're happy to do that and kind of walk through your operations and give suggestions and guidance along that route too. So again, it's triggered on one positive. We would come out and talk to you, or at least contact you to see if you're interested in having us come out. It's not regulatory. It's not required for us to come out. We are offering our consultative services to kind of walk through any questions you have or any issues, either ahead of time or once you have a positive employee, and how you kind of move through that. So our toolkit's kind of broken down into 3 main steps, and it covers a lot of the sections that Lee just covered in more detail. And ours is pretty high level and not specific if you've looked at it. And that's intentional because as you just heard, there's lots of options for you in your own operations for how you approach some of these things, how you do cohorting, how you train your workers, where you need to focus on different things. And so we wanted to make sure that we brought these things up for you to consider and then allow you to make your own proactive plan for how you can respond. So the first section really talks about protecting the current workforce. And again, that's displaying those educational materials, making sure that those materials are in the culturally appropriate language so that they're well understood, and that you point back to those things on a repeated basis. I'll talk a lot about like this being a culture shift. That we've been dealing with this since March, but it feels like a long time, but still we all struggle to remember to grab the mask when we get out of the car or whatever else. So it's just reinforcing that. And so making sure that that happens on a continuous basis. And then, communicating that, the seriousness to your employees so that they do follow it while they're at work, and they also follow it while they're at home, because this is a community acquired infection. We should assume that everyone is positive at any time, because we don't know. There are asymptomatic individuals. And so, like Lee mentioned, Rusty says this a lot. He's not able to be on the call today, but it's not if, but when, and how do you prepare yourself to protect your employees, number 1, and then also your operation, number 2. And one of those key things is, screening of employees. Talked about, do you screen them before they get into the van? How do you set that process up? How do you protect that information? Do you have an HR person doing that? Is that a supervisor that knows how to handle protected information and not share that? How do you work that? What do you document? What don't you document on a piece of paper? So just thinking through that process. I will tell you that we have at least 50 of those scanning thermometers available from the Department of Ag. So if there's an operation that is struggling to source one, doesn't have one, wants to start screening their staff, we can provide one of those to you. So you can get in touch with me directly, and I can make that happen. Reinforcing the employees stay home when they're sick. The last thing you want is an employee to come with symptoms, later find out they're positive, and then all of their cohort or close contacts then need to self-quarantine for 2 weeks. So the more you can reinforce that, if they've got symptoms, if they've been near someone, if they've any of those things, that they exclude themselves from the workforce and make it so that you're supporting them in that. And there's various ways to do that. I think the COVID sick employee pay was mentioned. I don't have a lot of information on that. It's outside of the Department of Ag's scope, but there are some of those programs out there that we're peripherally aware of. Making sure you're enforcing the face coverings when you can't maintain 6 feet physical distance amongst employees. So if they're working around a bin, like was described with picking leaves or wherever else in your operations, make sure they have it up over their nose. I don't know how many times I've seen people in various workplaces that they have it down below their nose because it's hot and it's easier for them to breathe. Well, that just defeats the purpose. So making sure you have that physical distancing officer who's enforcing some of these practices with staff, reminding them, put the mask over your face, reminding them to, wash their hands frequently, clean and disinfect surfaces on a routine basis. And if you are having trouble finding cleaning and sanitation materials, whether that's spray bottles, sanitizers themselves, Business Oregon does have a sourcing webpage where you can go and look for whatever products you need, whether that's gloves, face masks, sanitizers, and search for it and find businesses that do have it available. And they maintain that. So I'll put that in the chat box as well, so you guys can use it if you are struggling to find those materials. So the next couple sections talk about protecting the workforce or preparing your current workforce. So again, that's education of your supervisors and workers and reinforcing that education. So a continual improvement process, if you want to think about it that way. So constantly reinforcing that, whether that's the daily meetings, the daily calisthenics, if that's done at your operation, and just constantly reinforcing that for the culture shift, because people need to get into this just being a habit of doing all of the things that protect them and your operation. And again, it's multiple languages. If they can't understand it, they can't follow it. Reinforce that they should be taking these practices back home, whether that's carpooling or not, in their homes with their kids, everywhere else, so that they come to work healthy every single day. And then, cross training. I think Lee talked quite a bit about leaf pickers. I'm not an expert in vineyards, so don't know that whole process, but if that's a position that needs to be cross trained, so that when two of them are out, you can have people who are picking the fruit switch, think through all of those things and have backup plans, because that's what's going to get you through that period of when that cohort, for whatever reason, ends up with a individual who's positive and they have to quarantine for the 14 days. So think through that ahead of time. And then, that really leads into step 3 of preparing for an impacted or reduced workforce. Can you hire additional staff now for some of those positions? I know labor is short and it's hard to find people, so that can be a challenge, but have those contingency workers or have those cross-trained staff, or think about how you would, spread out your lines or whatever makes sense for your operation. And then another thing to think about, we often think about the employees doing the work either on a production line or in the field, but think about how you protect your management staff, your owners, your directors, your key staff who know and run the business on a daily basis on that higher level, and making sure that you're isolating those people, that you're not interacting with lots of other people that may put you at risk or that group at risk. I know for the Department of Ag, I myself as a program director, we don't have meetings in the same room. We don't interact as frequently as possible in person so that we're not exposing each other, as well as even outside of our workplace, that at home I'm making sure that I'm not further putting myself at risk that would pull me out of being able to work. So just some of those things to think through. So I'm happy to take questions when we get to that section and talk through anything else.
Thank you very much, Isaac. I appreciate it. I appreciate you running through that. And yep, I see some questions popping through, so we'll get to those as soon as Jennifer gets back on the line. And we mentioned that there was a new standard that was just released yesterday. I think it's still a draft standard, but Jennifer's going to talk to us about the new infectious disease standard that's just been released. And so Jennifer, do you want to get back on and run through that? I think there's a slide that is coming up right now that Stacy's put up for you.
Yeah, no problem. And I'm going to make it short because, as you mentioned, it just came out last night and I've read it maybe 3 times so far. So I just want to basically talk about, it's called the COVID-19 temporary standard. It's going to be in effect for 180 days, more than likely. They are expecting it to be in effect either September 7th, but no later than the 14th of September. Again, this is really going to apply to your wineries. Right now, the vineyards also can definitely do all of these things as well, but a lot of it is overlap with the rule I already talked about. But first and foremost, we really would hope that you try to do the 6-foot distancing between all individuals in the workplace. So whatever you can do as much as practical, that is great. If you cannot do the 6-foot distancing, then the face masks or face coverings do become required. There is one way out, and that is you can do impermeable barriers. And there's some really good examples of impermeable barriers that are in the rule. Please look it up. It's almost a math type equation that you have to come up with. But basically, it's if you put 2 people next to each other on your sorting line and you took a string and put it in both of their mouths, if you basically go over your barrier, it needs to be at least 6 foot or around your barrier. You have to pick the shortest route between those 2 persons. So just take a look at that, because if you do the impermeable barriers, OSHA would prefer to have engineering controls in place rather than requiring the face coverings if at all possible. So that is somewhat of an out for you. As far as traveling in employer vehicles, it's the same rule, 3-foot physical distancing, and then everyone in the vehicle needs to wear face masks. Mandatory face coverings, I already went over, is required if 6-foot social distancing cannot be done. Thoroughly, and one thing about that, I should go into the office settings, since I know you do have some office settings. It is now required to wear face coverings if you're not sitting at your desk. So if your desk is 6 foot from another desk, that's great. You're sitting there, you don't need to wear a face covering. But anytime you get up from your desk, you are supposed to wear your face covering, you know, going to the restroom or down the hallway, etc. So that's a big thing. The other thing with face coverings is they have a, basically I'm going to read it to you. It says face coverings are mandated whenever individuals are engaged in forceful exertion, singing, or shouting, and they are not separated from other individuals to their front by at least 12 feet. So just keep that in mind. I did talk with Matt this morning about what the definition of forceful exertion is, and it's a real interpretive. So it's going to be, they were really thinking about exercising in a high tense type exercise. So that's kind of what they were thinking of when they were writing this. But that's in there, and that's the 12 feet. So that's kind of new to all of us. Sanitizing surfaces, they are requiring that to be done at the beginning of every shift. And then if you are sharing items, and I use a stapler as an example, if you share a stapler, you are supposed to sanitize that in between users. Sorry. Oh, I have new puppies. I got them 2 weeks ago. Sorry about that. Hey girls, stop. So basically, employers with 25 employees or more, and that's anytime during the year, you do need to designate social distancing officers. So that's a little different. Oh, my slide, oh, there he is. If you're an owner of a building and you have other employers using that building, you are supposed to make sure the layout allows social distancing. And in addition, you need to post the requirements of this rule in common areas. So things like your elevator or your break rooms. I still want you to do providing information and training to employees. OSHA is coming out with a COVID-19 hazards poster that's going to be required to be posted. And in addition to that, we do want you to train your employees on the hazards of COVID-19, how to protect themselves, and so forth. So just make sure you take a look at the rule and get all those things that you need to be training on. And as a consultant, I always tell people to document your training so that you have proof that it's been done. And then there's a nice section about addressing medical removal of employees that require isolation. So it talks about, if possible, you want to reassign them to another job where they can work away from people. And that would be most likely people that are asymptomatic, that are positive with COVID-19, because they feel well enough to work. But if you can't reassign them, then you do need to provide whatever leave policies you have with your company. Or if you actually have the Families First Coronavirus Relief Act, if you have that coverage, that they can have that as well. And then finally, once they are feeling better and they're no longer contagious, those reassigned folks need to be able to be entitled to their original previous job. So next slide, please. So I wanted to just give you, this is the web page to our draft rule. It is a draft. It has not been accepted yet. And you have the ability to make comments. So this is brand new. It's still being written, if you will. So make your comments until August 31st. And you can see the email that I put up there, the tech.web@oregon.gov. That's how you can send your comments and questions and so forth. So that's basically it in a nutshell. Again, please go to that webpage, take a look at the whole rule and read it. There's also a nice 2-page summary of the rule as well, which is kind of how I got my slides put together so fast. But anyways, I'll answer any questions I can. I may not know all the answers at this point, but it is new and we're all kind of learning together. So thank you.
Super, thank you. Thank you very much. Sorry, was somebody back there needing to say something? Is that you, Tom? No. Okay, so there have been a few questions that have popped up, and for everybody who's on the line, there are a lot of links in the chat area that have been added by Isaac and Leda from Salud. So be checking there. If you don't know how to do that, it's at the very bottom of the screen where it says chat. You can click on that and you can scroll through all the chats that have been, questions that have been asked and links that have been linked to. So let's see, one question says, does related mean that people live in the same household? How are we defining the term related? And I think that goes to you, Jennifer.
Yeah, so basically it is basically folks that are living together. So they basically have all the same kind of exposures. So that's how we look at related.
Thank you. And a question also about COVID pay and when and how that applies and where that applies. And I'm actually not sure who would be the best person to answer that question. We might need to do a little bit of work on figuring out who the right person is, and we'll get back to you guys with that information. I'll put something up in the chat in a little bit. Dan Jarman had some questions to Jennifer about this new infectious disease standard, and I think, Jennifer, it's long, and I don't know if you want to answer it or you can read it now, or you'd rather just wait until you've had a little bit more time to sit with the draft. Up to you.
Yeah, I'm not very technology great.
I will read you. I'll read you the questions. It says, it appears that the new OSHA infectious disease temporary rule requires some additional requirements for workplaces at exceptional risk. How is this defined?
Yeah, that's a good question. Those are basically folks that are having personal contact with people. So it's our healthcare systems, as well as tattoo artists, our barbershops, our hairdressers. So when I talked with Matt Kaiser, the author of this rule this morning, he said that your industries, vineyards and wineries, would not fall under those sections of that rule. So you're under the basic guidelines for employers.
Okay, perfect. I think then that answers the rest of the question. So we will consider that answered. Leda at Salud also just wanted to reinforce a few things that were said, and that is that, you know, masks are important, that they cover your nose and your, as Isaac said, and to reinforce the idea of implementing masks when people are sharing a ride, even if it's not an employer owned vehicle. That should be one of the things that we're constantly trying to remind people to do, please. Somebody from an FLC said that they are responsible for paying people the moment they begin checking temperatures. So I'm not sure how that rule works, and if you have any guidance on that, either ODA, you know, either Isaac or Jennifer. Is that right? Maybe that's more of a bully question.
Yeah, I don't have anything to add to that. I don't know.
Sorry, Lee, can you repeat what the question was?
Yeah, the question was the moment that somebody starts checking temperatures of an employee, is that when, does that designate time started on the clock? And I think it's a bully question.
Oh yeah, it's not something I could answer. I think it probably is a bully question.
Yeah, we'll get an answer for you. And then there's a question about what kind of masks to wear, and there Leda added some information and a link to the chat, but her recommendation was that bandanas and neck gaiters are not as good at blocking droplets as masks are. And if anybody was at the Thursday Willamette Valley Wine Growers Association meeting, Sheila Sund, who's a physician, spoke quite eloquently about COVID and and the use of different kinds of masks. Also, that's been recorded. So if you didn't attend the Thursday meeting, you might want to go listen to that. And she will be again at this coming Thursday meeting, continuing the conversation. So I highly recommend coming and listening to Sheila talk about different kinds of masks. Isaac put up a connection to a supply connector portal. There was a question about whether there'll be another release of masks and sanitizers for folks by the ODA. And Michael from the Oregon Health in Marion County said that, you know, they have hand sanitizers, face coverings, disinfectant sprays, touchless thermometers. So it sounds like you can get in touch with, well, certainly Michael from Marion County, but each one of the county health authorities, and that might be another good reason to just check in and see what's going on with the health authorities.
Yeah, this is Lee, this is Isaac. On the part whether ODA is going to do another mass distribution across the state, we don't have additional masks that were supplied to us for that, so we've exhausted those supplies at this point. So I have not heard of anything happening in the future, but like as Marion County points out, they have some resources, and I'm not sure what the other counties have, but again, yeah, like you said, reach out to those counties that you're in.
Thank you. Reading through questions, hang on a second. There is a question that somebody asked that we'll get to later in the emergency response plan that says that if an employee tests positive and then goes into self-isolation, does the whole crew need to self-isolate? Winery pickers, let's wait till the end for that question as well. And I think with that.
This is Jennifer. I see one that says, when will the new COVID poster be available?
Mm-hmm.
And basically that, I don't know the answer, but I'm gonna guess when this rule gets in effect. So I would guess at least by September 7th, maybe as late as September 14th.
And then those will be required to be posted immediately. So this will be something that will have to be done right as harvest starts. So we'll try to make sure that through, you know, Tom and Morgan and everybody, that this information gets out to people so you know how to access these postings and get them up right away.
So Lee, this is Tom, one quick question that came into us in advance of the call today was sent in, and it was specific to face shields. And we can see in the chat room some answers being offered that bandanas and other non-mask, you know, coverings are not ideal. They don't provide the droplet protection. Does anybody on the line or in the chat room have a different feeling, or can they confirm the same assessment about face shields as opposed to masks?
So this is Jennifer with OSHA. I can tell you that we, as far as face shields goes, we definitely want, there's now new face shields we're seeing coming out that just cover the nose down. We're not accepting that. They do need to be covering the entire face. They need to wrap around the face and under the chin. So just keep that in mind if you do decide to go face shields.
And I know, just as an aside for us with our leaf pullers, we're requiring them to wear masks and a face shield. So that's, you know, getting both kinds of protection of your droplets and for your own self, for your eyes. Okay, with that, I think that I would like to thank Jennifer and Isaac very much. The amount of work that's gone back and forth with these folks looking at our guidelines and helping us has been exceptional. So thank you both very much, and thank you for presenting, and we appreciate it. And you guys are not done. So, yep.
Thank you.
Yep.
That's great. Thank you, Lee. Let's just pause for 1 second. I see we have some guests from Davis Wright Tremaine, and I won't put them on the spot, but if you feel anything needs clarification or a correction, please jump right in. I suppose we're ready. Lee, you ready to keep on moving, and we'll go to the next section?
I sure am. It's time for Anthony.
Thank you. Thank you. That was great. Thank you, Isaac and Jennifer and Jennifer's dogs and all of our guest speakers. Thank you for that. Lee, thanks for organizing that. Let's move on to the next phase. Anthony King, if we could pass the baton over to you. I know you'll be relying on Isaac and Jennifer as well. We also have OHA representative Stephen White on the line and some of his colleagues. But Anthony, is it okay if we kick it to you? I see your name and your first slide is teed up.
Yeah, I'm all ready. Can everybody hear me? Tom, can you confirm?
Roger that.
Perfect.
Confirmed. Loud and clear.
I'm going to keep this quick because I think we're running a little bit behind and we've gone over several of these things, but I will go over the bullet points. Lee talked about having a workplace coordinator, keeping up on the guidelines and being the first point of contact, especially for local public health, working with the managers. Mike is going to talk to us about the emergency response plan next, that the sample that we wrote up. Establishing a confidential process for employees to report illness, which Lee also touched on, is very important in making sure that people feel like they can have someone to take over if they're not there, is part of that as well, so that they will actually tell you if they're sick. Developing and communicating a policy on sick leave and Families First Coronavirus Response Act, which I still need to do some work on at the studio. So the big one I wanted to talk about is developing a plan for continuing business with reduced workforce. This is something that we found in the industry people aren't necessarily all preparing for, but that includes cross-training, which Lee talked about. It's training your employees from one department, whether it's the office, people who are working from home perhaps, or from the tasting room to do some work if you need to. Also having, perhaps having a consultant on standby or a friend, another winemaker, who if you as the winemaker get sick, you can call on them to come in, check on your fruit, taste wines, be a resource for your crew, but they need to be prepared for that. And know your facility, know the wines, know where things are coming from. So having those conversations early. We do know of a New Zealand winery that had both their winemaker and vineyard manager go into isolation, into quarantine for basically the entirety of their harvest. It all happened in 2 weeks. So it does happen. We've talked a little bit on the WVWA calls about pairing with other wineries. So whether you have other wineries within your same company, but you might need to just go to a neighbor winery and say, hey, if we have a crazy diminished workforce, can we, clear our facility, have it sanitized down, or make sure that it's safe for you, and then your crew takes over for us. And beyond that, also, if you do have a very diminished workforce, say you started with 7 people, you ended up with 3 based on either positive cases or the need to quarantine, then you might need to send your fruit somewhere else. And that's the next piece of work we need to do, is maybe creating a bulletin board of facilities that do have some capacity to take on extra fruit during harvest. It doesn't necessarily make a lot of sense to just keep adding fruit to a facility that doesn't have the workforce to take care of it. And then limiting interactions, we can certainly, if your office team or certain people on your team don't need to be at work, and they can work from home, then certainly they should do that if possible, just to keep your winemaking team safe. Also, closing off your tasting room or limiting that interaction is important. Posting signs, and we're ready for the next slide. So we talked about screening and monitoring illness. We've also heard from a few people with the idea of having, we normally give out a harvest pack, which includes flashlights, pens, Sharpies, things like that. Those are important so that they're not shared items. But also you could include in that, if you're a small winery and you're not screening at the door, if you do screen at the door, there's great guidance in the toolkit, the food processors toolkit that Isaac will talk about. But also, you might just give everyone a thermometer to take home and check their temperature at home. Also a list of COVID symptoms that they can put on the fridge, just so that they're always reminded of what those are. I know that some people don't know the gastrointestinal symptoms that can also be associated. And then another idea was a small hand sanitizer refillable that you can clip onto your belt buckle and always have with you. We talked about physical or social distancing managers, and then also, as Rusty pointed out, during our tour of Adelsheim, making sure that they are watching people and making sure they're distant on breaks. Face coverings are required, and the guidelines that we are sending out are meant to generate thought process for you. And I didn't bring ideas to you, but in there is a list of different ways that you might approach face masks. At the studio, for instance, if there's anyone else in the room, then you're wearing a face mask. That means that if you're working in a totally empty winery like I was this weekend, I don't need to wear a face mask. But certainly in working in smaller rooms, maybe wearing a face mask always is a good idea. But the main thing is creating a policy for your winery. Hand hygiene, we'll touch on that again in a minute. Meals and breaks for the winery. We are abandoning, a lot of people are abandoning their break rooms or moving them to a more ventilated area. Some different ideas were making sure that if you do have an area that it's being sanitized in between use, that's the key word there, is having a safe environment, and that for people's mental health, making sure that they have places where they feel safe, that they don't always have to feel like they have virus all over them. They've washed their hands, they can sit down at a sanitized surface, and that's really important. For us, we're giving everyone a camp chair, and they'll sit outside, or we'll find a place in a well-ventilated area. We also had questions on our WVWA calls about whether dishwashers are effective, and they are indeed effective, but you might still want to have names on certain glasses and things like that. I noticed at the winery that sometimes someone will set down a glass. If it's not labeled, someone else could come by thinking it's theirs, and that doesn't make very much sense. Next slide. Lee talked about hazard assessments in the winery. This is something you should already be doing, but this would mean that when you do your facility walkthrough, you have a special eye towards new issues, things that haven't come up. You hadn't noticed before harvest that people were going to be working close in a certain area. One thing that we've noticed on our walkthrough is that if we are going to be using our CO2 fans, it doesn't make much sense for someone to be working right outside that, where that fan is, the outlet, because then all of the air from inside is passing by them at a high rate. And if there is virus in the air, they'll definitely be breathing that in. And that takes us to ventilation. This is a very key point for wineries. If you can move operations outdoors, then do that. Spaces that are larger, taller, those are better. Small rooms, like labs, you might want to just assign one person to be in that room. Or as in the case for the studio, we're actually just moving a lot of our lab equipment out into the larger rooms, and then also having more of them, more lab areas around the winery so that they're not shared by so many people. And the CO2 fans are pretty important. You can turn those on, you can open windows, same for offices. And then for wineries, for facilities, you can change the filtration in your HVAC system. You could also add devices, which we might want to ask OHA about the efficacy of those. But also a key one is increasing outside air. That's true also in vehicles. This is another key, is creating cohort groups. And then I added consistent pairs for close contact. So creating groups that work together, whether that's people in a shift, but if you're going to have two people working in close contact, which is within 6 feet for a cumulative time of 15 minutes, then you might want to assign pairs of people that do that consistently throughout harvest. And we're definitely suggesting that those two people not be a winemaker and assistant winemaker, or people that are both key within a certain team, so that if someone does end up needing to quarantine or is tested positive, then you have someone to take over. And again, for working in those consistent pairs, recommendations for wearing a mask, of course, but also perhaps wearing a face shield as well. And again, that would be a part of your policy and a part of your training. Paperwork, we've learned that you don't, as far as we have found out by federal and state guidelines, you do not need to get your weight tags signed off by the driver. So that would decrease the amount of paper being handed back and forth of people that are outside of your facility. Assigning pumps and to specific employees or cohort groups, so that you're limiting, again, that passing of things back and forth. Staggering schedules is huge. If you can work longer multiple shifts, or have people come in at different times, certainly staggering schedules with indoors would be a good thing to do. Physical barriers. So a big part of the beginning of this conversation and the conversation we had at Adelsheim was about the sorting line. It's a difficult spot. The best thing to do is to build, whether it's plexiglass or a frame with clear shower curtains. That is a way that you can actually, that reaches 1 foot above your head. That's a way that you can divide between people. If your sorting line is long enough that you can get 6 feet distancing, that's great. Sorting lines for fruit facilities are oftentimes putting the physical barrier, and then they're also wearing masks and face shields for full protection. And all of those things, and moving the system outdoors, if that's possible, all of those things will be things that your local public health authority, if you have a positive case, will come in and look at to decide whether more of your team needs to quarantine. And Mike will talk a little bit about that. And then Lee talked about guidance for shared vehicles. So we'll go to the next slide. So cleaning, frequently touched surfaces are light switches, time clocks, coffee dispensers, etc. We've heard several people talk about putting the sanitizers such as ethanol on your forklift so that you can spray it down. Again, that's about creating a safe area for the next person. Oftentimes people sort of live on a forklift all day, so sanitizing that, whether that's at the beginning or at the end, that's a part of your training and your policies. You might even do it both times, which is generally our policy for anything at the studio. So this should actually say are not necessarily effective, the common winery sanitizers, but parasitic acid, the levels that they're showing on the EPA list are much, much higher than what we use in the winery. That doesn't mean that the levels that we're using aren't effective, but we don't actually have efficacy studies for coronavirus or related viruses at the levels that we're using. Caustic, sulfur citric. Alcohol, of course, does a great job at 70%. And then again, explaining and educating your employees on the idea that you need to clean surfaces and before some of these things can actually be effective. And that's really important. But in our tour of Adelsheim, we talked about the idea that you're not necessarily going to be able to get everything sanitized. And so if it's, say, for instance, the spigot on a water handle, that you can sanitize on a regular basis because people are touching it a lot. But just knowing that someone has to coil up the hose and you're not going to be able to sanitize the entire length of hose, that means that the big part of it is washing your hands and don't touch your face, which is why our little raccoon guy, the fastidious raccoon, is at the top of the screen. So just to go over it, the prime lessons, I think, are educating employees for washing hands, not touching their face, social distancing, having a social distancing officer, wearing masks and face shields as appropriate, increasing the ventilation and working outdoors whenever possible, staggering your schedule, working with cohorts and pairs in close contact, and then that big piece of preparing for a diminished workforce. And I will end by just saying another piece of that is, if you do end up having someone come in, think about whether or not you want to have a contract in place or something that gives them some protection, talking to your insurance agent, as we did, about whether your liability insurance covers you as you go to another facility. And ours told us that it does cover us. So at that point, I believe that let me see where we are. We're going to go to Jennifer to add anything that I might have missed. Jennifer?
Actually, Anthony, you did a fabulous job. I don't really have anything to add except just a reminder now that we have that new draft COVID-19 temporary rule. When that becomes in effect, there are some pretty good guidelines on how to design your barriers. So for your sorting line, make sure you take a look at that rule because you want to try to build it like they're explaining heights and all of those kinds of things, just to make sure. But you did a fabulous job. I really don't have anything else to add. So thank you for doing that.
And Jennifer, I had a follow-up question. If we do build it to those specifications, does that mean, is there a definition that would say if it's built to this specification and you're doing these practices, then it will not be considered close contact? Absolutely, or is it still just up to that local public health authority?
So I really can't answer how the Oregon Health Authority is going to look at something like that. But I can tell you in our rule, it actually meets the 6-foot distancing requirement. So if you were to put in a barrier in the way they describe it in the rule, then you technically wouldn't even need to wear a face covering. So, but yeah, that's how I can answer that. I'm not sure how OHA would look at it if they had to, do contact tracing and so forth.
Okay, I'm just gonna put myself on the screen just so I can smile, because that's fantastic. So if Jennifer doesn't have anything more, I'm gonna kick it over to Isaac, who's gonna talk to us about the food processing toolkit, which actually came out before the ag toolkit. And Isaac, can you tell us a little bit about that?
Yeah, Anthony, thanks. So I think again, like what Anthony and Lee have put together, they kind of mirror the 2 separate toolkits that the department put together, one for the ag operations and then for food processing operations. And what they've done is really made those more specific to winery and vineyard operations, which is fantastic. And so a lot of what is in our food processing toolkit is the same things that Anthony just covered. And it's very similar to the ag and farm operations toolkit. So again, it's broken up into those 3 sections about protecting your current workforce, preparing that workforce, and then preparing for that impact of a workforce and reduced workforce. And I would go back really quick to the barriers and whether or not you need face coverings or shields. The way I look at it is the more layers of protection that you can put in place for your staff, the better protected your operation and your employees are. So, even if OSHA says that that is no longer within 6 feet and you wouldn't technically need a mask, it still makes sense to maybe put that mask on to further protect them, or, so when they leave that protected barrier to walk across the facility and they come close to someone walking just by, they have that face covering on. Those types of things. But I think, Anthony, what you covered in your toolkit presentation really walks through what is in our processing toolkit with some more specific language to wineries. And so I would just put back out there that, again, where ODA is willing to come out and do consultations, we often bring the OSHA consultative services folks with us to walk through the facility at the same time, similar to what was done at a winery earlier. And can do that. And when available, we try and bring along one of the local public health authority individuals to answer any of those outbreak specific questions. It doesn't always happen because they are extremely overworked as they respond to contact tracing and some other stuff. But we're available, we're a resource, and we want to help in any way we can so that you can put in mitigation factors to protect your operations and keep things flowing, particularly as you move into this harvest period.
Great, thank you. And the guidelines that we wrote are absolutely based on the toolkit. That's where it all started. I remember when they very first came out, Robert Mosier at Northwest Wine Company called me and said, these things have everything that we talked about in our meetings, but it's all laid out in this very efficient format. You guys did an amazing job. And all the guidelines that we do is add just a little bit more detail specific to the wine industry. And those are fully reviewed and should be coming out this next week. So I think we're now on to Q&A. And so far, we don't have any added questions on here. Does anyone have a question?
Hi, this is Bakosi Dube here. I'm Senior Health Advisor with Oregon Health Authority. I was having some technical difficulties. There are two things that I wanted to chime in on. The first one being the face covering question or conversation that we had earlier. I posted the current OHA guidance on face coverings. So we also have a few infographics that specifically that address this issue specifically as to, cloth coverings equivalent to face masks or surgical / medical face masks and face shields, etc., etc. So I encourage you to look at the face covering guidance that I put up on there.
Can I ask you one question also while you're speaking? We had somebody ask about the idea of using face shields and how they might not be appropriate in every situation where you're in a place where you think that you could become infected. Are there any places where we need to be thinking about using goggles, or are face shields an okay protection tool to use for us along with masks?
That's an excellent question. So face shield by themselves are not equivalent to, are inferior to face masks as per the OHA and CDC guidance. There are, however, some situations where some people cannot wear face masks. So a face covering that wraps around the ears and goes below the chin is an acceptable alternative, though not equivalent. If you can do both, face covering and a face shield, that's excellent.
And is there ever a time when we need to go even one step further and wear goggles, or is the face shield enough to imagine that it will cover any droplets going into eyes?
So face shields are okay if you're wearing a face mask. So you do not need to wear goggles if you're wearing face shield.
Thank you.
I'll add to that I think we very quickly learned with masks wearing goggles and eyewear is difficult, which is our standard practice when spraying a sanitizer. So face shields have taken the place of that, and it's actually quite comfortable. So wearing a mask and a face shield for, say, spraying down tanks, things like that. There's a couple questions that have come through. A good sanitizer. So this is it's a difficult one. It came up in our guidelines about the use of ethyl alcohol in the winery at 70%. It's a fairly common practice for people to either buy 5-gallon jugs or not straight ethyl, or going and buying, Everclear and diluting it and having it in spray bottles specifically to spray out valves and things like that. That's what we're using. I have been trying to get questions answered from TTB. I've talked to OLCC about guidance about whether or not that's okay, because that was a question about whether or not that needs to be, how that needs to be tracked and registered and all of those things. But that is what we're doing. Parasitic acid, again, so James Osborne and I have been trying to find answers on whether or not it's effective at the small amount that's being used. And the ones that are on that EPA list are actually at a much higher concentration, which does not mean that the concentration that we're using doesn't do it. My suspicion is that it's probably it's probably time related, is how long does it take? The same for caustic. We didn't talk about ozone. That's another one that, again, cannot find any good guidance on. Ozone and air seems to do a good job, but we can't find any studies that absolutely say that ozone dissolved in water does a good job. Again, my suspicion is that it does. It's a crazy oxidizer. But again, that's not something that we could put in the guidance because of that. Jennifer, could you answer what is the website to get the temporary guidance from OSHA, or did you already answer that? Oh, there it is. Okay. Yeah, so Jessica asked about indoors, concerns for aerosols versus droplets. Perhaps someone from OHA could answer that?
What is the question?
It was about indoors, the concern for aerosols versus droplets.
That's a very good question. We actually had, all the senior health advisors had 1 hour lectures times 3 from an MIT physics professor on this particular issue. And what we came to the conclusion was that this is primarily a droplet disease, droplet mediated disease. However, when you're in a small room with poor ventilation, aerosol spread, aerosol transmission also comes into play. Hence the recommendation that outside is better than indoors. Large, well-ventilated places are better than small, poorly ventilated areas.
That's great. Thank you. And that reminds me, another thing that the ODA had recommended is just keeping your fans on in the restroom in between uses, so that it's just constantly changing out that air. Oftentimes restrooms are quite small. Let's see. How should wineries that provide housing for harvest crew handle distancing requirements in the house? Is the group of interns considered related as they are living together for a period of time? Jennifer, is that a question for you?
It is, but I don't know if I have an answer for you. I think that would be something I'd need to get back to you on, just to make sure. Is the question basically the interns arrive at your facility and then they're housing together? Is that the question?
Yeah, it's fairly common for wineries to find a local vineyard house and either charge, they would pay rent to that person, but oftentimes interns are living together. Whether or not some wineries own a property and they're living there. So it is complex.
So, Bukosi Dube here. This issue has come up several times with the farming community and has been addressed adequately by OHA. If people are living together, they're considered a family unit. They're considered a cohort. So if I don't know if that answers this particular question, but we, in talking about migrant farm workers, we talked about that they're a cohort if they're living in the same household.
Okay.
Okay.
I think, did I answer everything?
I think you did.
Okay. Here's James Osborne. How should wineries that provide, oh, that was the same. Okay.
Same thing.
I think we're good.
That's great. Thank you, Anthony. Thank you, Bukosi, for the link you provided. We'll make sure we'll get a number of these links out to people. Thank you for your commentary also, Bukosi, and we'll get a number of these links out to folks along with the link to the recording, of course. If I could ask Diane, if you don't mind, maybe just a little bit of commentary before we get into the third and final portion of the formal program. Diane from Davis Wright Tremaine, make a really important announcement in the chat room here about some learning from Gebber's Farm up in Washington State that had just a catastrophic outcome with an actual fatality. And I know you've provided, I think, a link there to the FAQs there. Would there be any commentary briefly that you would like us to have, or any additional information that would not be in the link that is helpful warning to Oregon wine businesses?
Yes, I would say that Gebber's Farm is an operation that really tries to comply with all of the regulations, bringing in their foreign farm workers and taking care of taking care of them to some extent, even above and beyond what's required for compliance. So I think the point has been made here that with this disease, it is hidden, and even those who take best efforts can end up with an outbreak, however small. So I think a point here is that getting out ahead of the situation and letting your customers, your contacts know that you're taking it seriously by keeping on top of the requirements, and consider posting something like the similar FAQs to Gebber's Farm on websites.
Good, thank you, Diane. Yeah, that's a sad outcome, but thank you for that way to make sure it doesn't happen again. Isaac, if you're still with us, thank you for the offer that you made again for you and your colleagues to provide consultative services to business owners, in advance of any terrible emergency. I think Rusty Rock had given us a list of ODA people around the state that business owners in the wine sector here could contact to take advantage of that consultative offer. If I can't locate that, I'll come back to you and Rusty for that again. I think there's about 6 or 7 names, but if that was still the correct list, we'll send that out again so that people around the state understand exactly who is relevant in their region from ODA. Do you think most of them would be okay with having their names published to our industry members?
Yeah, Tom, okay. I think, and maybe I'm not sure what Rusty provided previously, but I know like how we're handling it internally is we have one main email address where we're getting that information in so we can assign it out to staff, given some people are off sometimes. So if what Rusty provided you is what I think it is, I think that's probably okay. It should be our FSD manager's email address, which is a catch-all, so all of us managers will see that and then be able to get that local inspector out in contact with whoever.
Okay. So if I can't locate that,
we can touch base.
Yeah, if I can't get that, I'll just go right to Rusty for it. I understand what you're saying. We'll provide one address to the industry. Okay. Lastly, before we get to our third and final section here, Leda Garside with Tuality OHSU, I think you lead the league in chat room additions and links, and I mean that in a positive way. Thank you for all the great stuff that you're feeding us here in the chat box, Leda. I wanted to give you just a quick minute if there's anything that you wanted to add verbally to all the great stuff you're giving us that we can share with industry members. Any special points of emphasis? You might be muted if you're out there. Anyway, there's a lot of good stuff in the chat. We'll try to filter through this chat stream here and pick as many of the links as we can. Hopefully we can grab all of them, but I know everybody's got just tons of stuff to read, and try to get the ones that seem to be relevant to the most frequently asked questions on this call. To keep us moving, maybe we pass the baton now to the guy who's kind of been our beach master on this exercise, pulling all this together over the last several weeks, all these modules, and we're really appreciative, Mike McNally, of all that you've done. And I think best thing to do is give you the floor now.
for the third and final section.
Thanks, Tom. Can you hear me all right? I know it's been stated, but just to be aware, there's actual guidelines we will publish on all three of these sections: vineyard, winery, and emergency response plan. They will be posted on the OWB website and on the WVWA website. Those were developed, as you can see, with OSHA, ODA, and OHA guidance. Moving to the emergency response plan, this has been an area that we have found to be the most difficult to provide a black and white answer to. Having been a systems analyst, I'd like to have yes, no answers and get to a final conclusion. It's difficult to do that in this particular area. I'll just summarize my comments by saying that if you start out by saying if someone is sick, they have symptoms, they need to stay home and they need to see a healthcare provider and follow the guidance of the healthcare provider. Rule number one. Rule number two, if someone has had close contact, if they come to you and say, hey, I think I had close contact with COVID-19, you need to investigate. And we'll talk a little bit about some of the questions you need to ask. But you eventually need to go to your local public health authority for guidance if you have any confusion there. And then third, if your business has a confirmed or a presumptive case, and the word presumptive is a key word from the local health authority and from OHA, if they're confirmed or presumptive, you, number one, need to contact your local public health authority, and number two, they need to be quarantined. With that introduction, I'll go to this first slide and say that an ounce of prevention is worth 5 gallons of disinfectant. You need to perform a hazard assessment. And if you get the 3 different sets of guidelines we're talking about, and you add to that the toolkits that Isaac has talked about, and you just walk through those in your business, and you think first about the facility, ventilation, protective barriers, signage, traffic flows. Secondly, administrative and organizational guidelines like education, training, letting know people how COVID-19 is transmitted, what the symptoms are, how do they protect themselves, the guidance from OHA on face coverings, physical distancing, and how to disinfect. And then finally, making sure that you have enough of the supplies on hand. You don't have to write it all down. You don't have to have a formal process, but every few weeks, go through that thought process: facility, organization, supplies. And we believe you need to develop an emergency response plan in case you do have an incident or an outbreak in your business. Next slide, please. So back to the first point I made, if an employee is sick, they must stay home. And I've listed the symptoms here of COVID-19 in the order that we're seeing them in Oregon. OHA actually records symptoms for any confirmed case. And the first symptom is cough, headache, muscle aches, chills, fever greater than 100.4 degrees Fahrenheit, shortness of breath, sore throat, loss of smell or taste, nausea. If an employee has multiple symptoms, if they have these symptoms, they need to stay home. They can't be at work. And doing screening first thing in the morning, just asking these questions, having a sign up that says these are the symptoms and making people be aware of them. You don't want them in your facility. You don't want them on your crews if they've got symptoms. And if they are sick, encourage them to contact their healthcare provider. And if they don't have a healthcare provider, ask them to talk to the local public health authority. And there are, that website is easy to Google. If it's a non-confirmed, i.e. they didn't get tested, and non-presumptive, i.e. a medical healthcare professional did not say it's a presumptive case of COVID-19, they need to stay home at least for 24 hours after the fever subsides. Obviously, if it's a confirmed case or a presumptive case, we're going to get to that. Now, a local public health authority or a healthcare provider may give guidance different, and that's what should be followed. One other point is if somebody's waiting a test, they say, hey, I got tested yesterday, they need to stay home until they get the results of the test. Next slide, please. This is a tough one. If an employee has had close contact, I can't tell you the number of conversations I've had with wineries and vineyard managers that say, hey, an employee just came up to me and said they were out to dinner with their cousin and their cousin had exposure at work. Does my employee have to stay home and quarantine? What we would say is that people that have had close contact with a confirmed or a presumptive case, including outside the workplace, need to quarantine for 14 days. But the key is, what is close contact? OHA and CDC define close contact as closer than 6 feet for greater than 15 minutes. However, masks and dividers and ventilation may reduce the risk of that transmission. And so again, to really define close contact, you'll many times have to get a local public health authority or involved. Request employees with close contact to inform their supervisors. Now this is a tough one because HIPAA says employees don't have to discuss their health situation with employers. But up front when you're doing your training, you should be requesting all your employees to self-monitor, to follow symptoms, and if they have close contact, to let you know. If they let you know, the first thing you need to start discussing is, was it close contact? Did the person have a confirmed or presumptive case? Did the person, was it greater than 15 minutes, less than 6 feet? The company management may want to contact a local public health authority for guidance if you feel that it's equivocal at all. If you think there's a chance that it does meet the definition of close contact with a confirmed or presumptive case, you should contact your local public health authority. Now, the local public health authority themselves will contact employers if they identify a community-based exposure, and the local public health authority will provide guidance for other employees regarding that close contact. There was a question in the chat room, if somebody tests positive and goes into isolation, does everybody else have to isolate? Or another question similar to that, does everybody else have to get tested? That's a question for your local public health authority. And if you have a positive or a presumptive case, you need to get your local public health authority involved. Next slide, please. Now, here's the time when we know that somebody has tested positive or that it's a presumptive case. What's a presumptive case? For my definition, and I'll ask our local public health authorities and our Oregon health authorities on the call to correct me if I'm wrong, but a presumptive case is a case where a medical health provider or a local public health authority has said it's a presumptive case. You as a business shouldn't be in the business of trying to say it's a presumptive case. You should seek advice on that. But if somebody tests positive or they say that they've been advised by their health provider or by a local health authority that it's presumptive that they have COVID-19, they should be advised to quarantine. And again, request guidance from your local public health authority if you have a positive test, an employee that tests positive. If an employee tests positive or has a presumptive case, they need to quarantine for at least 10 days plus 24 hours after the fever had subsided without taking fever-reducing medications. So if on the 11th day they still have a fever, can't come back to work. On the 12th day, they still have a fever, can't come back to work. If they stop taking aspirin and other fever-reducing medications, and they've been out 10 days and it's been at least 24 hours without a temperature, they can come back to work. The local public health authority is required to share positive results with employees. You need to follow confidentiality and privacy practices. In our emergency response plan example, we have numerous links to the various HIPAA and privacy principles that you can reference. And it's a good idea when you're training your employees to say, out of concern for your other employees, please let us know if you have symptoms. Employees cannot be required to disclose health information. I'm sorry, you can't force employees to disclose their health information, and you cannot require employees to show negative test results to return back to work. You should encourage employees to cooperate with their local public health authority if they are presumptive or testing positive. Next slide, please. The key here is local public health authority. The statewide health authority, Oregon Health Authority, gives us a lot of good guidance, but when it comes down to the individual situations, it happens on a county basis. And so you need to contact your local public health authority if you find out that you have a confirmed or presumptive case in your workplace. That local public health authority will notify state agencies and the various response teams required in the state to deal with the situation and to provide you further guidance on who needs to get tested or who needs to be quarantined. The local public health authority will provide interviews if required. OHA defines an outbreak as 2+ cases within 14 days of people that share an epilink. And that's people that are working together and have direct close contact. They will report publicly outbreaks of more than 5 cases in facilities of 30+ employees. Primarily ODA, but a lot of times Oregon OSHA will assign a local inspector to coordinate and identify if you need further escalation or cleaning of your operation. We've generally been guided that our health agencies, Oregon OSHA, ODA, are all committed to prevent and to avoid unnecessary closures. Next slide, please. So we talk a lot about the Oregon Public Health Authority that we need to coordinate with. What we've done is we've reached out to Oregon Health Authority, and they have provided us with those contacts in each county. We've identified those key contacts. I'll show them to you on the next slide. We've also identified a wine grower, either a winery or a vineyard representative, to work with each of those local public health authority organizations. What we've asked those wine growers to do is, after this meeting, to contact the local public health authority representative and discuss the example emergency response plan and get feedback from the county whether they agree with that approach that we're now giving you the guidance on at this conference, and confirm if those emergency response protocols are what's required in that county. The wine grower contact will then provide the local public health authority any other guidelines that we've developed if the public health authority is interested. And then my final slide is the matrix of local public health authority representatives in each county with their emails. You can also get this on just by Googling local public health authorities, and it also provides, you generally want to go to the individual that handles infectious disease within the local public health authority, and they've got phone numbers and everything else to contact them. And these are the winery contacts that will be working with those health authorities. Now, we're not suggesting if you have an incident, you should contact the winery contact. No, you should contact the local public health authority. We're just using the winery contact to inform the local public health authority of the work we've done. With that, I'm going to turn it over to Sally Murdoch to talk about a key part of emergency response plan, and that's the communication protocols.
Hello, Stacy, you got my PowerPoint?
You know, this is Tom. I'm sorry to interrupt, but I was just going to ask, Mike, we've had just 1 or 2 questions pop up that are specific to some of the stuff covered there. Do you want to take it on now, or just let Sally finish and then circle back?
I'd let Sally finish because
okay,
and circle back.
Okay.
Okay, so I'll get started. So this is, I wrote this plan, a communications plan, on July 24th, and my colleagues at the Oregon OSHA, ODA, and OHA warned me that this would be a working document. There will probably be lots of changes, and that, so these are some pullouts from that plan itself. So the purpose is pretty easy. It's the more prepared we are to communicate with transparency when or if an outbreak occurs at a winery or vineyard, the better the messaging will be and the more trust will be developed among staff, media, or press members and your customers. So I approached this plan with that in mind. Next slide, please. Just some very basic, broad paintbrush of the basics of the communication during an outbreak. These are laid out by the World Health Organization. First is trust. The key principle of this outbreak communication is to communicate in ways that build, maintain, or restore trust between the public and outbreak managers. Without trust, people don't believe, or more importantly, act on the health information that we're trying to get out. Second is announcing early. Even with incomplete information, this prevents rumors and misinformation. The longer officials withhold information, the more frightening the information will seem when it's eventually released, and this erodes trust. Third is transparency. Maintaining the public's trust requires ongoing transparency, including timely and complete information of real or potential risk and its management. Listening. Understanding the public's risk perceptions, views, and concerns is critical to effective communication in the broader emergency management. Finally, planning. That's where this presentation starts. And as I've mentioned, I have developed a 5-page Word doc communications plan, and while we focus on getting that tighter with more changes and getting it closer to center, this presentation can serve as a door opener to presentation and communications. Before we go to the next slide, the World Health Organization also points out that planning is important, but more importantly, it has to translate into action. Okay, so next page. When it comes to employee communication, when there is an outbreak, it seems like OHA has covered this really well. They have a template for communications that is a very, very thorough letter. Hopefully this link is still up and live and updated, but the things that it communicates to your employees is the date of the COVID identification, support in the form of a phone number or email that employees can go to, testing resources, and also the definition of close contact, which Mike underscored really well, to prevent further outbreak, which is being within 6 feet of someone who has COVID-19 for at least 15 minutes cumulatively. Next page. As we get into media relations, there are 3 things to remember. Pretty simple. Before an outbreak occurs, designate a person at the winery or vineyard to speak to media. It doesn't have to be the CEO or an HR person. It's just someone that can devote their time, kind of push aside things that they're working on so that they can be available to speak to media when and if an outbreak occurs. Assume that the media or press will find out about an outbreak. The data for COVID-19, there's a weekly report that goes out Wednesdays at noon. The data for that is pulled at 11 p.m. on Sunday night. So any kind of outbreaks that happen that week, the OHA puts out that following Wednesday. If a worksite outbreak reaches 5 cases or more between Sunday and Tuesday for 30 or more employees, then it will be reported the next week on Wednesday. So workplaces have at least 24 hours notice before being named in this report. Also, when the workplace outbreaks reach 20 or more, the outbreak is named in the next day's press release. So that second bullet, the reason I bring that up is that if there are 20 cases, then it gets bumped up in severity and becomes a press release that gets issued. So again, assume that the press are going to know. You may not release the name of the COVID affected person to the media. It does say in some documents that you cannot talk about how many cases there have been, and that's why I say that's a question for OHA or Oregon OSHA or ODA, can we release the number of outbreaks? And if someone knows that, please let me know either in chat or now if you can, if it is okay to release the number of outbreaks per business. If we can go back 1 second, Stace, sorry. Another point is whoever you identify as your spokesperson to the media, know that an outbreak will cause an influx of work for them and that they'll likely need to have more space to clear their calendar for media requests, press conferences if necessary, producing material to hand out to the press, language translation and support, and there might be reporters working on stories like this that don't know a lot about health. They may be lifestyle reporters, they may be trade reporters who may need more explanation about your business and other things. Okay, page 6. So developing talking points for press could be done ahead of time, even today if you want. What I do is I keep a rolling document on my desktop, just keeping examples of things that press might like to know about later. And some of these, in talking to press once there is an outbreak, keeping them positive and proactive and include action steps your winery or vineyard is taking are important. So in your own words, talk about things like how quickly you communicated with staff and a quick response time. That's really important for press to know. Also, in trying to stop that spread of COVID-19 in removing the infected person from the workplace, that's something that press would like to know as well. Talk about measures you have put in place to stop the spread of COVID, both in the work areas and in the break room. If you do decide to close your operations to clean and disinfect for 24 hours, do tell the media that. That is a message that you want out. Similarly, if you're disinfecting high-touch surfaces, tell the media about that. Basically, all the things that you're doing to work with OHA, ODA, and Oregon OSHA and inspections and employee safety. Those are good talking points to have when the press do call. And then finally, page 7, customer communication. So your customers and partners will want to hear from you and know that you're handling the situation swiftly and responsibly. Consider, like I said, ceasing operations for 24 hours for a deep disinfect. And if you plan to do so, do tell your customers about it. Considering drafting a letter, email, web post. Other places you might think about posting information, your website, call center, multimedia section for the media and general public, social media, a digital press kit, and and also tailor these communications resources so that they're all in one place. It's difficult to predict when things will get back to normal, but businesses can't always make promises to their customers, but communicating about how you plan to continue serving customers while being transparent in these times of uncertainty is appreciated. Next page. And these are some of the contacts that we have. As press call around, I assume if they can't get a hold of a winery, they're probably going to call me at the top first, and I'll be ready to answer positively with as much information as I have. I might put that on pause as I dig in for more information. These are the PIOs that we work with who are talking to the press daily. And then on the right column, I have the task members who are drafting this toolkit and playbook who you've heard from today, Mike, Lee, and Anthony. And that's all I have for communications. If anyone has questions, let me know.
Thank you, Sally. And I apologize to OHA. Is Stephen White or Jordan Wiley still on the call?
Stephen had to punch out, but I think Morgan McClafferty is offering some comments in the chat room, but we did want to come back to playbook, and Stephen offered Isaac up to make any final comments on the playbook that maybe you were thinking of, Mike?
Yeah, I was just, Isaac, would you mind just talking about the playbook and what it is and why it was developed?
Yeah, sure, no problem. I'm happy to do it. So the playbooks really arose out of early cases where we had multiple employees at food processing facilities go out sick and needing to close those operations because they just didn't have the staff left to continue to operate, and being on calls on the weekend with, 3 different agencies and a dozen people from each and just all trying to figure it out. And it was pretty clear that we needed to have that clear, coordinated effort for how we were going to respond, and so that we were consistent when it happened again, because we all knew that it would eventually happen again and we'd need to be ready to respond. And so OHA had already done some, what they were calling playbook development for the congregate care facilities early on in the pandemic, when they had multiple people in those facilities getting sick and that spread and trying to get their arms around it. And so they developed a playbook process there, and we really modeled the 2 playbooks we have for food processing facilities and ag operation facility or ag operations around those. And those documents are pretty high level documents, and they're meant to be internal, but we are sharing them publicly. And they really just lay out the agencies involved and what their roles and responsibilities are, and then what our actions or protocols will be when there is an outbreak at one of these types of facilities. So I mentioned earlier that our consultations for the toolkits are triggered at 1 positive employee. And so the way it works is when an individual gets tested through a lab, that information is sent to local public health authorities and OHA through their system. And if they determine that that individual works for one of these types of operations, processing or ag, they notify us, and we begin the process of trying to set up a consultation where we come out and walk through those toolkits and see what mitigation factors you guys have already put in place. If there's gaps or areas that can be supported, we're also there to support you in that if you do end up with that large number of staff that put your operation at risk of needing to take a pause or close or shut down for whatever reason, that there's a process to elevate that through the state to say, this is critical infrastructure for our state, and we need to make sure that we put some additional resources. And where can we find those? Do we have those available? Do the counties need more help from OHA to step in with additional testing or other types of support? So that's really what that playbook documents are meant to be. I think I covered most of what is there. It talks about like Oregon OSHA consultative services coming. This is intentional because this whole playbook process and toolkit response process and consultations is not regulatory. And it was set up intentionally that way because we want to be invited out. We want to be a resource and support industry in working through this. And so it was clear we couldn't have their enforcement division come, that it needed to be separately firewalled and have their consultation staff. And that the scope of what we're looking at is really COVID mitigation measures that you have and how we can help shore up and support that and give you resources around that. And I think that covers the high points of the playbooks. And I mean, if there's questions about it specifically, I'm glad to answer any of them.
Thank you, Isaac. And we developed the example emergency response plan consulting with that. I guess I would just ask Isaac or Jennifer or any local public health authorities or any Oregon health authority on the call if they would like to correct anything that I said regarding our example emergency response plan or expand on anything I said.
Hi, my name is Megan McClafferty. I am an epidemiologist with OHA working on our COVID-19 response. Mike, I thought you did a wonderful job. I really respect how much you guys have invested in being really prepared in the event that you do have any cases, and the information you provided is super thorough. I did want to just emphasize a couple of things. Presumptive cases, I realize, can be kind of confusing and it feels a little nebulous. Presumptive cases are people who are sick, not just any symptoms, but they have at least 2 of cough, fever, anosmia, so loss of taste or smell, or pneumonia. So they're considerably sick, and they also have to have had contact with a confirmed COVID-19 case. So those are people who we know have been exposed, and then we know that they've developed pretty compelling COVID-19 symptoms. Often those people haven't been tested. So if they were tested and came up positive, they would be confirmed cases. So presumptive cases often aren't people who are presenting to healthcare. They are people who maybe are feeling sick, but they don't really need to seek care. They haven't sought testing, they're staying home, which is great. Staying home is the most important part, but that's not something that you get diagnosed as from a healthcare provider. If you're seeing a doctor, they're gonna test you and you're gonna be a confirmed case, most likely. So a presumptive case is really a public health surveillance definition so that we can capture those people who we are pretty sure are COVID-19 cases. So it's not something that you're going to hear from a doctor. It's not something that your employee is going to be able to say, I'm a presumptive case, unless they have spoken to the local public health authority. And it's not something that is your job to determine whether somebody is presumptive. So on your end, if somebody shows up to work and they say, hey, I was seeing my cousin last week and now they're COVID-19 positive and I've got this cough and fever, you can say that they need to call their local public health authority or, of course, their doctor if they are sick and need care. And then we can determine whether they're actually a case and they need to stay home in quarantine. Of course, anybody who's sick shouldn't be at work at any time, even if you don't know that they've been exposed. But I just wanted to kind of firm up the presumptive case definition. I know it can get confusing kind of in a public-facing manner. It's really a public health surveillance definition for our purposes. The other thing I wanted to touch on was outbreak definition. So this was mentioned, an outbreak for any pathogen, E. coli, influenza, we define as 2 or more cases in separate households who have compatible illness. So they don't necessarily need to test positive, they just need to be sick with consistent symptoms. However, in kind of higher risk settings with COVID-19, we've created an outbreak, which just means we put it in our database for monitoring purposes at a lower threshold. So we are doing this for long-term care, and we're doing it for some high-risk employment settings in agriculture, including wine, since people work in really close proximity and it's essential work. We create that record and start monitoring, looking for other cases, thinking about testing at 1 case. So that's when that playbook that Isaac mentioned comes into play. So that is where you come in. You are not a healthcare provider. You don't need to call the public health system if somebody tests positive, because we're getting those lab reports. That's our normal process. We are going to know, we're going to call them, they're going to say, hey, I work at this winery. But it is your job when you have COVID-19 in your facility, at 1 case even, to call your local public health authority and talk about whether this does warrant an outbreak investigation and that further follow-up where we would kick that playbook into play. And that's just a great connection to have with your local public health authority as well, where you can try to make sure that you're on top of your precautions, and then we can let ODA know so they can do some consultative services as well.
That was extremely helpful.
Good.
Do you see Anthony King's question there? Would love to hear from Megan and Isaac about whether they have seen what they have seen with local public health authorities around the state asking employees to quarantine due to close contact. Were they wearing masks indoor?
So close contact, that definition stands inside and outdoors, and masks we do not view as personal protective equipment that would make you not a close contact. So the mask, whether you were or weren't wearing it, it reduces your risk, of course, and it's something that we really want to encourage. But if I was within 6 feet of you for 20 minutes, even if I was wearing a cloth mask or a bandana, there's still a risk. And so you would still be identified as a close contact and need to quarantine for those 14 days from exposure.
Perfect. And then there was the other question from Herb. I've had an occasion where an employee has reported that they had close contact with a person outside of work who at a later time tested positive. 3 to 7 days before the contact the contact tested? Is our guideline that the person should get a test?
We don't have firm guidance in this instance. We have stopped short of providing guidance for contacts of contacts. And if somebody develops symptoms or becomes sick long after you saw them, the risk is lower. But that's a conversation to have with their healthcare provider or with public health, who can kind of confirm whether that person even was a confirmed case or presumptive case. That is not something that you, from your vantage point, can do with the information that you have. So I would just advise employees to monitor really closely for symptoms. If anything feels off, stay home. And then if they do develop symptoms, to seek healthcare or get tested. If they were identified as a close contact in the course of that public health investigation, when the local public health calls the case and they identify those contacts through contact tracing, then your staff member would be notified that they had been named as a contact and would be advised to quarantine.
And then the last question I see here is that if the total count of your employees is less than 30, would the outbreak ever get reported?
Yeah, so I put together that report. I'm happy to answer questions about it. No, we do not report small employers. That is to protect confidentiality. We are very wary of releasing any identifying information. So we will only report those with 30 or more employees. As a caveat though, that does include all permanent staff, seasonal staff, and contracted staff. So we're not looking at who's on whose payroll. It's just how many people are exposed and work in one environment.
Well, thank you very much. And I would just like to thank all of our health associated agencies that have worked so hard with us on this. I'm not going to call out names here. I'm going to turn it back over to Tom and see if you have anything else on the agenda, Tom.
Just real quick, boy, I really appreciate that last point you made, Megan. We have so many medium-sized and early-stage family businesses in the wine category in Oregon. And boy, is it helpful to know that that 30 threshold is all inclusive of seasonal staff, contract workers, as well as permanent part-time and permanent full-timers. It might be surprisingly easy maybe for a medium-sized business to trip over that 30 trigger point and become somebody that you would be keeping an eye on. Thank you for that. Let me see, we have probably just a couple minutes left real quick. One thing I did want to mention, if Brent Stone is still on the line, we have seen some of our wineries in Oregon really get far out in front on their own with their own safety standards and adapting and adopting some of the guidelines and recommendations that have come from within our industry that we've gone through in detail today. One of the better ones I've seen, a couple of the better ones, one is Crimson Wine Group, another great one was done by King Estate. And Brent Stone, if you're on the line, I was just going to invite you, if you could, real quick, just to comment on anything you've learned as you've implemented the standards, any advice you might have from running a large-scale winery that might be relevant to even the mid-sized and smaller business. And the thundering silence tells me that Brent might not be on the line anymore. So thank you for that. When Sally Murdoch was going through the communications information, she mentioned PIOs, Public Information Officers at state agencies. Those were the names that were listed. I would underscore a couple things that Sally had in her communications. And you'll have these slides, of course, as you will all these slides. We'll put them in the COVID bulletin that's coming out from the OWB. But I would say a couple things. When I was at Kraft Foods, there was a product integrity question that led to a very, very small recall long, long ago. But a couple of things Sally said are really important. It can be tough to put the toothpaste back in the tube with respect to how you want to have your message get out. Once it gets out through social media or through media coverage, if there's an unexpected and a undesirable outcome in terms of publicity, if you were unlucky to have maybe an incident in your workplace, it is tough to go back and correct sometimes all the perceptions that can just fly out, especially in a time when just about anybody with access to a keyboard can now start putting messages out socially about your business and your brand. The best precautions are some of the things Sally said. Be prepared with a spokesperson in advance of a crisis, and arm that person with the list of points that they can rattle off about how you've communicated with your staff, with customers, and with the consumers who buy from your customers, if that's relevant. But certainly your staff has to be communicated with. Do that prep inside, because crisis communications is a very, very specialized business. There are PR agencies that do nothing but that, but you don't want to be in a position of having to rely on a crisis playbook if you can avoid it. Be prepared in advance. Morgan, thank you for your comments. Mike, I'll underscore everything you just said. All of our external partners, we just owe them a tremendous debt. Let me just throw it open real quick. Any of our partners at all who are on the line before we adjourn with anything that you want to make sure gets said that's important that didn't get said already?
I have a question this is maybe for Megan or some health authorities. That I believe it was the OHA, when I was talking to them about talking points, they said one thing reporters seem to be asking is, or could ask, is if a COVID infected worker touched a wine bottle and the process goes through to the store, how quickly or not quickly does that imprint go away? Is that a valid concern? Can we just kill that with the press right now and say that's not a reality?
Yeah, interesting question. I haven't received that one regarding wine specifically, but plenty of other grocery products and
right.
Consumer goods. That is not a transmission route that we think is really a driver of disease transmission.
Okay.
It's up to you how to approach that with reporters, but in general, any viral load that is going to get on an object like that, we call it fomites. So anything that gets onto a wine bottle, that gets diluted over the process of handling and shipping and making its way to the end consumer, and the viral load that's going to be on that object is pretty low, not high enough, most likely, to make somebody meaningfully sick. So just touching it after it's been handled that long and then taking that hand and doing whatever with it, pretty low chance of transmission.
Okay, that would be a good answer for a writer then.
Yeah, don't disinfect your groceries and wine bottles. It's not necessary.
Okay.
Good,
thank
you.
you.
Good question.
Megan, one more question.
Go ahead.
There is one more question that Anthony asked, but I'd like to hear what Megan says. Is there a difference between how you decide to test winery workers versus agricultural vineyard workers? Is the standard different for a vineyard worker than an indoor winery worker?
When you say winery worker, do you mean food production and processing, or more front of house tasting room staff?
I'm referring to food production,
Okay.
people actually making the wine.
Yeah, our guidance would be the same. Agricultural in the field and processing settings. You have the difference of indoor, outdoor usually in terms of precautions that you're able to take and need to take, but testing guidance would remain the same for those groups.
Thank you.
That's good, thank you. Let me see. Isaac, if I could ask you real quick to confirm one thing. We're going to get out the list or the email address that you gave us earlier so that people who want consultative assistance from ODA can get it. I want to make sure we're reassuring anybody who relies on that. Consultative does not mean the enforcement staff is coming.
Right, that's correct. So consultative, this is all non-regulatory. We're just there in an advisory role. For ODA, it is what would normally be your normal food inspector, likely, especially for winery operations. For OSHA, it is their consultative services. So, yeah, what we're doing there is not regulatory; it's consultative.
Got it. Thank you. We'll get that out. Morgan, if you're still on, I was going to give you a chance if you wanted just to comment anything about the Thursday call that WA will have, if you wanted to, about any agenda items or anything that will kind of continue this thread we've started today?
I'll answer. I know that we're having the second half of Sheila Sund on.
Yeah.
The recording from last week was great. I think we're working on seeing if, Morgan and I haven't touched base, but seeing if we could get a little bit of guidance from someone in human resources.
That's great. Thank you. Yeah. And again, those are open to everybody. Thursday at 10.
Hey, Tom, there's one more question on here for
Go right
Megan
ahead.
while she's online. Megan, I don't know if you could read that in the chat, or would you like me to read it?
Yeah, I was just typing away to Chad. The question is regarding when staff are working at multiple work sites. So they work for one cohesive company, but maybe they're going to harvest in multiple locations that are pretty far away. So what is the number that we use to determine how many total employees to reach that 30 above or under threshold? It really is super case by case in terms of an outbreak investigation. We do not provide hard and fast guidance on this because there is so much variability in different settings and different groups of employees. But I can say that we are looking at who is an epidemiological cohort, so who is exposed to each other on an ongoing basis. If you can say that you have staff who work in one region and they only work there and then they don't see anybody who works on other sites, great. We might look at that as one cohesive group. You know, there's tons of companies statewide that have multiple locations, and we don't look at the company, you know, at corporate, how many staff are on their payroll. We look at who's working where. But if you have staff who are working at one work site, you know, for a few days, and then they're moving somewhere else, maybe with a slightly different group of people for another few days, we would probably consider that a cohesive cohort of people who are exposed to each other.
Thank you.
I'm sure we could keep going, but I think we've reached the end of our line, end of the time, unfortunately. We do reserve the right to grab some of our subject matter experts back for future calls. This has just been a excellent dialogue. As I mentioned, the WVWA call will continue with some of these topics Thursday, and we will be back as a group next Tuesday at our regular time of 11 a.m. for the next in our Tuesday calls, again, open to everybody. And we may need to have a couple of these folks back if they're available. Their input has just been excellent. So thank you to all of our speakers, Lee and Mike and Anthony and Sally and Jennifer, Isaac, of course, Megan, I'm probably forgetting people, Diane, thank you for everything that you've done to prepare, everything you've offered today. Bukosi, thank you as well. I know Stephen White from OHA was on the line, but had to leave us. We'll be bringing some of you back, and we just hope this is going to be kind of a continuing dialogue on some of these questions, even though we're getting really tight on time here. We'll just try to keep the information coming to you, and I'm sure you'll let us know where the gaps in the information flow are, and we'll try to correct them. So thank you all for dialing in. Thank you, Mike, Anthony, and Lee, for the excellent preparation. Bye now.
Well, they didn't really